Good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Jr. Family Broadcast Studio. Delighted to be back with you on a beautiful sunny Friday morning. Man, doesn't that feel good to be able to say the sun is out. Today is Follow-Up Friday, and as promised, we will answer your questions from the week and talk about what's next for this morning media update. But first, Dana Hawkinson, Medical Director of Infection Prevention and Control, Doc Hawk, Hawkeye, a lot of other names we call him around here, is here with our numbers. How did we do overnight?
You know, well, I'd first like to start off. Hays is doing good, 0 patients. That's always good for our rural communities, which we know generally is less vaccine uptake. Here at the health system, we are doing pretty good. 10 active infections with 4 in the ICU and 3 on the ventilator. We still have 7 in that recovery period as well.
So those are better numbers overall. Some important stuff coming out overnight, Hawk. First of all, and very interestingly, if you look at southern Missouri and the statistics in Missouri where vaccination rate lags and is kind of the lower tier of the country, hospitalization rates have tripled overall in Missouri. And it's really in those counties where there's just not a lot of vaccine being given.
Yeah, no, absolutely. And talking with one of my ID colleagues down in Springfield, I think he only noted 1 or 2 of the 100+ people in the hospital at that time were actually vaccinated.
Yeah, it's important statistics. You know, the other interesting thing is the country where the Delta virus has been really spread, or besides India, of course, is England. And yet in England, even though they're getting a lot of Delta virus because they do a lot of genomic sequencing, they're not seeing the rapid rise in hospitalizations. In fact, hospitalizations are relatively flat. I think what the story is, vaccination works.
Yep, absolutely. You know, we have seen this. We've seen very good data come from Pfizer, Moderna vaccines showing protection there. We've seen a little bit from AstraZeneca, although we don't use the AstraZeneca vaccine here. And now Johnson & Johnson actually had a press release, I haven't seen the data or the publication, but showing that they have protection too. And again, I think it's, number one, the overall antibodies that are created, but also it's that very important other arm of the immune system, those T-cell responses that are generated by the vaccines.
You know, so yesterday I was in clinic and had a long clinic, and one of my patients was there with one of her parents, and they're like, yeah, we haven't been vaccinated yet. And you know, I tried to get the little spiel and do the talking, but I wasn't getting real good listening. And there was just this wall, and it's a wall of misinformation about vaccination, and you just can't break through it. And I don't know how to break through it. And I'm afraid that eventually they'll have had enough risk from it that somebody close to them is going to pass away or be really ill, and maybe we can get into long haul syndrome and all the problems you and I see all the time. And when that occurs, they're going to say, oh, why didn't somebody tell us this? And it's like, oh, no, we're trying to talk to you about it every day. And people have to choose to listen. And I don't know how to get folks to listen and to believe other than to keep trying to tell the truth every single day.
Yeah, and I think, you know, it's not just you. I've had a patient in my infectious disease clinic who also has declined to get the vaccine. I think for medical providers, for physicians, this is probably something that everybody is seeing too. And we just have to continue, again, to give the message, answer the questions as needed, but also there is a lot of just obstinance there and just opinion and seeking the narrative to support that opinion. But we have to continue to tell them and let them know and answer their questions. When they ask thoughtful questions, give our thoughtful answers.
Yeah, I think that's it. No flapjacking.
Nope, that's right.
No flapjacking. Well, Jill, let's see if there are questions out there from any reporters.
So I would say no.
I would say no. All right. As you know, Dr. Hawkinson and I have been doing the morning media update essentially every Monday through Friday since the beginning, or what it feels like the beginning of this darn pandemic. Today marks episode 326. Okay, I'm going to tell you, folks, that's a lot of freaking episodes. We may have missed an update now and again. There were some holidays there, but other than that, we've been here. And we've been faithful to our intentions around this update, which include keeping the community safe from COVID-19, staying in our medical lane, answering media questions and community questions, and telling you the truth as best we can, especially when we've been trying to build the airplane while we flew it. Over time, many of you have expressed that you enjoy our time together in the mornings, and we're hopeful that we're going to stay around. we've given it a lot of thought and have decided that we will keep this appointment with you every morning at 8 a.m. It may look a little different. I want to point out how grateful we are to media for streaming this update, and we hope they will continue to do it as we make some changes. The information is still going to be great. Dr. Hawkinson and I both need to get back to part of our day jobs, which include taking care of patients, helping run a hospital and a health system, and other work, maybe even seeing our families now and then. But we're not going to go too far away. Instead, we're going to bring in some reinforcements and add to our team. So we'd like to introduce you to Jessica Lovell. Lovell. I knew I could do it right.
I would feel left out if you didn't mispronounce my name.
Okay, this is a funny story. I sometimes butcher last names, and you may have noticed that over the year. And so I was practicing it beforehand. Okay, I just got to think of shovel. I got up to this just
Shovel
now,
level, okay.
And I got up to there and said, okay, is it shovel or shovel? I couldn't remember. Anyway, Jessica Lovell, unlike me, which is fortunate, she is an actual professional television host. She's going to take on the heavy lifting of the update on Mondays and Tuesdays, Thursdays and Fridays. We'll still be watching and sharing the COVID story. Doc Hawk will join Jessica every day to answer COVID-19 questions. We will continue to give the daily inpatient count and track vaccinations and variants. I will check in on Wednesdays in my own program. More on that in a moment, though. But first, I want to get you to know Jessica. Jessica, in addition to having a successful broadcast news career, you're a mom and you're a Kansas City area native. Let's start with where you grew up.
Well, thanks for letting me sit here at the table with you guys.
No, you're the best. This is awesome.
Appreciate you making room for me. Yeah, I am. I was born and raised right here in Kansas City. And unlike you, I went to Shawnee Mission South for all you Raiders out there. And unlike you guys who probably took a straight path to becoming doctors, I kind of took a squiggly line on my route to becoming a journalist, and went to Johnson County Community College and started taking journalism classes. And from there, I got a job in St. Joe, Missouri. I'll tell you about that here in a second.
All right.
Interesting connection. And that's just kind of where it all began.
Awesome. Now, you have children.
I do.
What are their names and ages? And by the way, I remember we've been introduced to one of your children
You
before,
have.
too.
You have. So Sonny, this is Dominic and Sonny, my two monkeys right here. Dominic is 5. And he's going to be in kindergarten, and Sonny is 8. She's going to be in the 3rd grade. And Sonny came by the office during the pandemic and ran into Dr. Hawkinson and was very excited she got to sit up here. She was very upset
cool.
that you were not around.
Well,
she wanted to go up to your...
I'll come down here and meet her sometime.
Because she did. She said, I want to go up to his office. Can we just go to his office? And I said, he's a little busy these days. But next time, you're on the list.
All right.
So, yeah.
So
they keep me hopping.
So you're a news anchor and a news reporter. You've kind of done this kind of job. You're like the professional here in the room, right? And I know that your last city where you anchored was Las Vegas. What was that like?
You know, it was a whole lot of fun. It was a lot of hard work. Like I said, from St. Joe, I went to Joplin. A little shout out to our Joplin viewers, and also in Topeka, Kansas. So landed in the bright lights of Las Vegas. So yeah, a whole lot of fun.
Wait,
back
is
when
that
I had
you right
that's
there?
blonde hair.
Yeah.
Wait. Let's come back to this question.
Las
Is that you right
Vegas.
there?
That is me. that is me. The many hairstyles and colors of the typical news anchor.
Yeah, there you go.
But it was a great city to be in, and a lot of great stories, a lot of hard stories, tough stories. But you know, you can't work
Wait,
in
were
the.
you
A lot
with
of
Elvis
celebrities
Presley?
that you got to meet.
Did you find Elvis Presley?
I
Is he still
did.
alive?
He is alive and well. And I know Dr. Hawkinson gives me a bunch of trouble about all my celebrity sightings. But you can't work in the entertainment capital world and not know Wayne Newton.
Okay, there you go. I like
And
that.
and then my favorite, of course, we have Donny Osmond. That was my other best friend.
Yeah.
So it was a lot of fun. But ultimately, after spending 10 years there, I had to head back to Kansas City. Truth be told, I had my kids a little bit later in life, which meant I was older, so my parents were older, and I wanted my kids to know their grandparents. And just as much fun as I was having, coming back to Kansas City was just where I needed to be.
Well, we've loved having you, and it's been so cool that you've been here at the hospital, and I get that, because when my wife and I started having kids, we were like, oh my God, do we need help? So we moved right back home. So it's been the best thing. Well, how'd you come to work here at the hospital?
Okay, so my journey to the hospital actually happened 20 years ago when I met a woman that you all know very well, Jill Chadwick.
Who?
So that would be one Jill Chadwick. 20 years ago, she was my news director. She gave me my first job in television. And so I tripped to the restroom at a restaurant when I got back here in Kansas City. I ran into her, and she just kind of the rest is history. She said, "Are you working?" I said, "I'm not." She said, "Well, let me tell you what we've got going on at the hospital. We've got this great news studio, and will you come work with us?" So it was like the full circle moment, as they say, and we're back.
That's great.
All right, besides your hosting, what other changes are going to happen with the morning update?
So the idea is that we don't really want it to change that much at all. So you're going to see Dr. Hawkinson, and we're going to bring you in when we need you,
Hey,
which
when
may be often.
things aren't going right, I'm going to be back. No worries.
And you'll be around, but we really want it to feel the same, look the same. We're just going to add more lifestyle, wellness, health, fitness, food, all different topics of health that may affect you or your family and the people you love. So we really want to kind of open that up and engage our viewers into other things. So.
Because we know there are other problems. We've seen this
There are
reported.
other problems, yeah. So.
Lack of screening that has gone on during the pandemic for cancers, and there are heart disease and stroke and all those other things. So
Yeah, so-
Things are going to be out there, and we're going to be talking a lot about them. So
And
this
a
all
few
starts next.
A few public infections, right? Other than COVID.
That's right.
So this all starts next week after the 4th of July. What are you going to be talking about then?
Okay, so we're going to be talking about the COVID-19. I can't talk about COVID because I'm not a doctor, but I can talk about the weight that people gained and trying to lose weight
I wonder when the scale was going to
during
come out.
this time.
The
So,
wavy hickory barbecue chips. There's a good visual
Yummy.
for you.
so we're going to be talking kind of about just our relationship with food and the psychology behind it and different ways to lose weight and when to know if you need medical interventions. So we're going to be talking a lot about that, and it'll be fun. It'll be a good way to kick it off.
It will be. Now, you've been working behind the scenes throughout this pandemic, hosting an internal show we call Take 10, where we keep nearly 13,000 employees who work here at the health system informed of what's going on. You've interviewed Doc Hawk on there many times. Tell the truth. How do you feel about working with him on the update? Because let me tell you, he's tough to work with.
Well, I was gonna say-
you got to really work to contain the guy.
You have broken
Diva.
him in over the over 350 shows. You've broken him in. I think we're ready to take this on. So
Yeah,
I
he
think we
did.
can do this.
Man, he
We can
does
do
such
this.
a great job. And I remember back the first few days you and I were up here. We've evolved a little bit.
Yeah.
It's
So
been
we're-
good. So I want
Yeah.
to learn more about what you're going to be doing.
Okay.
Open mics. Love the name of the new show. It's going to be
Yeah.
on Wednesday morning. Tell everyone what you will be talking about.
You know, we're going to talk a lot about different subjects, and I think we're going to be doing some deep dives. We're going to be doing some things that we don't do traditionally on this thing, and the topics may change from one to the other. You know, we're going to talk with Dr. Gerard about things here at the University of Kansas and challenges for the university and for education in general. We're going to have a big program about AIDS because, you know, we've talked a lot about it, and so many people are like, this is the only pandemic we've lived through. This is my second pandemic, folks, and I just think we need to get into and touch a little bit about AIDS. We have some great guests for that day. So it's got to be deep. We're going to go a deep dive about some things around cancer, some new therapies that are coming out around proton. I mean, these are going to give us opportunities to get into things we don't really touch on here.
Right.
You know, and I think we'll still be very timely. For example, let's say there's a lot of gun violence in the community. Well, let's talk about guns as a public health concern. Not as trying to ban guns, but what does it mean from a public health perspective? How can we do better? Do we want to talk about institutionalized racism? Let's talk about the public health effects of that. We're still going to be staying in our lane, but we're also going to be having a broad spectrum of topics, and I think it will give us an opportunity to introduce our viewers to new people around our campus and nationally who can give us some insight about some of those kind of cool things.
And you're going to still be taking viewer questions, as always.
Absolutely. Reporter and viewer questions. Somebody
Yep.
reporter wants to think, hey, we got to get some cool information from these folks. Happy to listen to them. Happy to talk to viewers, too. That's the best.
Okay, but next week you're taking a break.
I'm fly fishing in Colorado.
Of course you are. So I'll be here Wednesday, but you're going to start your show the following Wednesday,
Yes, I
right?
am. Yes,
okay,
ma'am.
sounds good.
We'll be here to debut.
And you said Dr. Gerard, your first guest?
I believe that's right.
Okay,
Unless he
good.
decides he can get a better date than me.
No, I don't think so. Okay, so if you'll let me, and if Jill doesn't mind also, I'm going to kind of get the wheels turning for me, get some practice on asking questions.
You go for it. We've got all the answers.
I know. A lot of these
Yeah.
are for you. So, Jill, I know you're going to have some community questions coming in as we're asking these. So do you mind
Sure.
if I check back in with you?
Go for it.
All right, I'm going to do it. Okay, so I'm going to ask you guys the first question. So we mentioned it's the 326th show. Take a deep breath. That's a lot. So what do you remember about the very first update? Go all the way back.
Oh, God, I remember the telephone.
Yeah, I think that's what it was.
Speakerphone, yeah.
So if you can imagine, this is a phone, and we were all huddled
There
around
you
the
are.
telephone, looking down at it, and we didn't even have white coats on back then.
Yeah.
And we were probably a little more awkward than we are today. What do you
Yeah.
think?
We're still pretty awkward.
No,
You know,
come
I think we have to set that in the context. There wasn't a lot of widespread community prevalence of the disease, so we still didn't know a lot. You know, it's not just about that first press conference or update. I think it was that whole week or 2 weeks. I had just gotten back from actually a Mayo Clinic infectious disease conference on early morning Sunday, and we had gotten our first patient that day, and it was the next day we gave the press conference. And then from there, you heard about the Big 12, and you heard about the early St. Patrick's Day canceling. So it was that whole week, really, where I don't think we slept at all, and that was the
didn't sleep.
biggest
We didn't
deal.
sleep. Because of the way we were supposed to have 50,000 patients and
Yeah.
all those things. And
Yeah.
I remember doing the pulmonary consult on that first patient. It was on a Sunday, and I went into her room and to see her. And we had our whole space outfits on at that
Yeah.
time, so we didn't really know all the infection dynamics. And what I really remember the most was the fear in her eye, because we just didn't know very much at all.
Yeah.
And I think that's still partly the story, is the fear in people's eyes when they get sick with COVID-19. I will never forget the fear in her eye.
Yeah.
And, fortunately she did well, but she was sick.
Yeah.
And she had been at one of the biotech conferences out in Boston, which turned out to be a super spreader.
Yeah, it was. Yeah, exactly. And, we had her in that our 2 rooms where we have for the emerging infectious disease that we had originally had for nearly a decade for things like Ebola and other things that have come up. So we had preparations made for that, and had recently also had a group to come in and survey that to make sure everything was really going good. Since that time we've changed to 2 or 3 different units, ICU units for COVID. We've got our systems, protocols in place now, but it was really that first week that was just kind of really fast-paced.
It was fast-paced, and I remember starting the first Chief Medical Officer conference then and trying to get everybody on board. And then we ended up having to restart closing down surgeries, closing down clinics, switching to telemedicine. It was crazy.
So did you have any reservations, though, about reaching the community in that way, doing it over the phone and then eventually on camera? How did that evolve, and what were your thoughts on that?
We had to make a choice, and do we stay silent, or do we talk? And if we stayed silent, because we were concerned, gosh, if we talk about it a lot, are we going to get all the COVID patients? And then we can't take care of all of our other patients. And what you quickly realized is that staying silent was just not an option. It's not who we are. It's not our culture at KU. It's not what we do as a health system. If you're going to lead the nation in healing, teaching, caring, and discovering, I don't think I did those right, but those are the 4 key things. If you're going to lead the nation, you have to lead. And to be lead, you can't stay silent. And so I think it was a strategic and a very important decision that we thought we need to lead, but then we want to involve the community in the leadership. And that's why we invited other hospitals, other chief medical officers, and other teams to be part of our conversations as much as possible, because we wanted to have the city say, all of us are leaders, and we can all take care of COVID-19, and we can keep our city safe. So it was really a decision about how to lead.
You both touched on it a little bit, but Dr. Hawkinson, when was that sinking feeling for you, that moment where you thought, what's this going to turn out to be?
I think, again, in that first few months, there wasn't really a sinking feeling per se, because we were so fast-paced. We were trying to figure everything out. This is what I got into the field for, is for these infections. Not quite like this. We don't want to go through a pandemic like this. But then things kind of slowed down, and then we had vaccines, and that was happy. And then, the variants came up, and it's like, oh, what is going to happen now? It just seems like every time something new comes up where you think there's a light at the end of the tunnel. But overall, it hasn't necessarily been a sinking feeling. I think we are extremely fortunate that even during the shutdown, we were able to still come into work. We had social interaction. Our lives didn't change too much compared to a lot of people's lives. So I was actually always more thankful during that time, just seeing what other people were going through and understanding what I was going through.
I think Hawkeye's most sinking feeling was when he realized that the name Hawkeye was never going to go away.
It will never go away.
I think Doc Hawk is here to stay, which is awesome. I think when Anthony Fauci bobblehead guy. When Fauci came out and said, this is a respirable disease like the common cold, and people get really sick, for those of us who have been involved in infectious disease and pulmonary, you know what that means. And we've been taking our CF patients for years, and we study infection control all the time in CF. And so when he said that, and he looked discouraged, that made me scared. Because, and then when it was in China, and they said, we can keep it in China, I was like, no, you can't. It's a respirable disease. It's going to be on every plane, and once it gets on every plane, it's going to go all over the world. And you knew it was coming. The question wasn't if, it was when. And I think that when this guy gets concerned, we should all be concerned, because he is a voice in the wilderness around this pandemic and all the craziness and all the crazy conspiracy theories and all that. Was he wrong some of the time? Well, of course. Again, we're building the airplane while we fly it, right? That's just part of the deal. But was he steady and was he honest? Absolutely. And I think that respirable thing, when he said, this is a respirable disease like the common cold, only it's deadly, that was a scary moment.
I remember sending you a text message, I think I still have it, where I said, are you familiar with I had a reporter call, and I was looking at this coronavirus, back when we called it the coronavirus all the time, and they said that it might be coming to the United States. And I texted you and I said, are you familiar with this virus in China that might be coming to the United States? Of course, you said you were, and but that was the first time. It was
in January.
Yeah,
maybe.
It was very early on.
I remember thinking, I was getting nervous in December, and then I tried to go order some masks. You couldn't find them. I was like, oh, this is not good.
Not good. Okay, so, and I've had a chance to talk with a lot of frontline workers and doctors and nurses throughout the pandemic, and a question I ask a lot is, where does this rank? Where does COVID rank, this pandemic rank, as far as your career goes? What does it mean as you look back and as you look forward?
Yeah. You know, this is one of the two greatest challenges. AIDS was a great challenge. It didn't have the same number of people being affected, but the in-hospital mortality rate was about 60%. And so, and it was all young, and so AIDS. I think enough time has gone by, and so many people now weren't alive for the AIDS crisis that people have forgotten that a little bit. But I want to tell you, that was really bad.
40 years,
really
though.
hard.
Is it 40 years this month?
It's been 40 years.
40 years.
But I think the pandemic has been so hard because it affected so many. And with AIDS, you knew how to not get AIDS. With the pandemic, this problem was you were scared you could get it anywhere. And I think that is the distinguishing feature about it, which made it a broader public health emergency, although not as deadly, right? It's really not as deadly. And so, but you could prevent AIDS easier than you can prevent COVID-19. I think that's the part that makes it so hard.
Where's it rank for you?
I mean, it's ranked top
Number
1
one.
through 10, basically. But I think the other thing about HIV/AIDS is what has helped us get out of that. Certainly in developed countries, we still need to do a lot of work in underdeveloped countries, but it's been the science.
It's science.
And it's been the antiretroviral therapy. The same thing with this, although the science is expedited here in the pandemic, which we all need to be thankful for.
Well, we've grown up and around science so much.
Yeah.
Our techniques are so much faster than they were.
Yeah, and we are, everything we've got to this point is because of standing on the shoulders of everybody and all of the science that has come before that.
Hawk, that is the perfect turn of phrase.
Yeah.
Standing on the shoulders of the giants who came before us.
Yeah.
That makes such a difference. I listened to that New England Journal podcast yesterday, and they were talking about how this is so rapid. We did such a great job with this vaccine, et cetera, and it was still too slow.
Yeah.
And I thought to myself, it is slow relative to Star Trek true warp speed, but it's still that was a great turn of phrase, standing on the shoulders.
Yeah. And I think we also have to be thankful for those researchers that contributed to that at Pfizer and Moderna, because we've seen that that other German company that has come up with that RNA vaccine doesn't have the efficacy, but certainly in their press release didn't show the efficacy. So I think we are extremely lucky to have those companies.
It is remarkable.
Yeah.
I mean, that part of the story, even though we can say, it could even be faster, that's a remarkable story on how fast this vaccine was developed. And folks, just to be clear, it wasn't too fast.
No.
And it is still phenomenally safe. You mentioned antiretroviral therapy for HIV. Think of all the side effects of that.
Yeah, right.
But people take it because they save their lives. These vaccines are so freaking safe, and people are still afraid of them.
So for both of you, what are the long-term health effects of COVID that concern you the most, and why?
I think we still don't fully understand exactly why that happens. Is it some continued immune dysregulation? But then going beyond that, what are the actual effects? I think the fatigue, we already know there is a lot of fatigue for one reason or another in our country, whether it's chronic fatigue syndrome or other reasons why people are feeling down like that. So I think fatigue, I think the brain fog, hopefully these other symptoms like loss of smell and the shortness of breath will improve throughout time. But I think we really want to see what is the mental functioning like the brain fog and just the overall fatigue going to do. How long will that take to resolve, if it does resolve?
I think the biggest thing, for me, this has been a fascinating year, because not just the COVID, but think of all the other social upheaval we've had over the last few years and how it's all taken effect, and all seem to occur in parallel with this disease. The murder in Minneapolis and I can't breathe. I think that turn of phrase is what scares me the most as well about COVID-19, because at the end of the day, I'm concerned that many of the long-term effects of being on a ventilator and having COVID-19 are not reversible, because in the lungs, when you get scarring, the scarring doesn't resolve. Inflammation resolves, but scar doesn't. And so I'm afraid that there are people, because they didn't get vaccinated, and especially some younger people, who are going to continue to get devastated by the disease, and they're not going to be able to breathe. And there's just nothing you can do to solve that, and short of a lung transplant, which has its own set of problems. So I think I can't breathe is the thing that scares me the most about COVID. It's how most patients die, is they die a respiratory death, meaning they can't breathe from the COVID pneumonia. And it's the longest term, even if you get out of the ICU and you've been on the ventilator, that's great, but how much lung function are you going to be left with? Now, I think to Hawkeye's point on the long haul syndrome, there's another type of I can't breathe that goes along. That may resolve. But that one from the initial insult, that's going to be tough for a lot of people for really maybe all their lives.
Thank you for making that I can't breathe connection.
Thank you.
Because breathing is life. Okay,
It is life.
So we said that we're in this new wave, this third wave. What's that going to mean for going back to school? What are your thoughts on the holiday coming up?
Yeah.
Celebrate good times. Come on. But do it with their vaccination so you can be safe.
Yeah, I think
I love
continue to say vaccination. I don't know about this third wave. Certainly, in those rural communities or those communities with less uptake of the vaccine, if they are seeing what's going on in Springfield, hopefully that will change a lot of opinions and they can get vaccine uptake. I still anticipate that fairly soon, maybe within the next 4, 6, 8 weeks, we'll have more information about child vaccination, so 12 and under, and get your children vaccinated to keep them in school again. Keep them being able to participate in things. Also reduce their risk, or really stop their risk of getting that multi-system inflammatory disease. So I'm hoping that as we continue to move further into this summer and into the fall, vaccination rates will increase, and we will be able to increase vaccination or get vaccination to the young children as well.
How about this? Instead of celebrate, we can go, vaccinate your arm. Come on.
Oh, I like that.
That's pretty good. Vaccinate instead of
Yes, I like
celebrate.
it. This
We
is
should be
good.
doing
You
that.
just
That's a
thought
cool
of
term.
that.
I did right here.
The whole time you were saying something so important. He's
Yeah.
over here thinking
I
of the
saw
next
his
song.
eyes light up. I knew
I
exactly
know,
what.
and he knows that's going to be trouble.
I don't do a
Eyes
lot
light
of
up.
singing,
Well,
but
I don't do singing either.
I see that.
I do a lot of butchering, let's be clear.
Okay, so do you have anything else to add on that, or is just the song? That's
it's
it. We're done.
vaccinate.
Okay. Okay. So do long haulers have immunity longer because their symptoms persist?
Oh, no.
No,
No.
we don't have any indication or data to support that. Again, even if you've had COVID-19, the recommendation is still to get the vaccinations because of improved overall durability of your immune response.
All right, let's talk about seniors. They've been among the most vulnerable, as we've talked about. Kansans report only half of the staff at long-term facilities being vaccinated. Does the Delta variant pose a greater risk to those unvaccinated residents and employees?
Well, most of residents are vaccinated, so I think the vaccination rate in senior living is about 95% for the people who are the residents of the senior living. The employees are a problem because what happens is they can still spread the variant, and then they can't work, and then they can be sick, and then we can jeopardize the people in senior living through a different route. There may not be enough people to take care of them. That's what I would be most concerned about. But I think the people who live in senior there are safe, and we know that because they quit coming to the hospital, right? We just don't get them from the nursing homes symptoms. We're very rarely, and if we do, it's because they've not been vaccinated. We'll occasionally get somebody who's been in there who's been vaccinated, but they have a lot of chronic health problems. They probably didn't have a good immune response, but most of them get better and go back to senior living. We keep saying that we're not making it up. It's all about the darn vaccination.
So why is the staff having such an issue getting it?
I think it's the same issue we see throughout the public, right? I mean, if I can answer that question,
I was going to say the million-dollar question.
Yeah. Why in our staff? How come we're at 75 or 80%, not 100%?
Right, I know.
Right?
I had to ask.
It drives you crazy, and you're just like, what are you afraid of?
Right.
And it's been a rush vaccine. No, it hasn't. Vaccinations follow the same principles and theories. If you're going to have a side effect problem, it occurs right away. And by the way, we've given over 2 billion doses of vaccination around the world. Say that number out loud. 2 billion. Name a drug that's been through a trial with 2 billion people in it, and tell me whether or not that was a good study. That's an amazing study. The amount of vaccine that's been given are just crazy. Crazy high. It's safe, Hawkeye.
Yeah. Oh, it's absolutely safe and efficacious.
So I am one of those people who have, what are the 2 billion? And so are a lot of other moms out there, parents, but they're
my
young.
2 billion, maybe it's 2 billion doses, 1 billion people, something
Okay,
like that.
so 2 billion doses, yes. So I took two of those doses, and but my kids haven't because they're too young. They're 5 and 8. So talk to us a little bit about the Delta variant when it comes to that, as we're waiting for those younger kids to be able to be vaccinated, and what are we going to do about school? Should we be concerned about that as parents, protecting ourselves?
I think if you're vaccinated, you're safe. I think that's clear that the ones in the United States, J&J, Moderna, and Pfizer, all work well against the Delta variant. We're a little less certain than J&J one. That's a little earlier and probably premature, but the Pfizer and the Moderna ones are clearly proven. The first shot is good. The second shot's where you get to 89 or 90% efficacy against Delta. So I think in that situation, you can be safe if you've had both of your vaccinations, and then I don't think you have to worry as much about your kids going back to school. I'm hopeful that, to your point earlier, we're going to start seeing some data that says we can go younger and younger on vaccination.
Yeah, and remember, the issues about not having to mask if you're doing things and around other people, those are for fully vaccinated people. So again, we know children aren't vaccinated. The other information that has come out that is really positive is that if everybody who is eligible for vaccination in the household is vaccinated, you do have a reduced risk of spreading it to those unvaccinated people in the hospital, i.e. the children. But I think as we move forward, I think, and we've heard talked about this for the past week or two, it's going to be about the infection dynamics in those geographic regions. And so I think it's going to be up to those administrators in those geographic regions, those legislatures, or the school boards to really understand and determine what is the level of risk, get everybody who can be vaccinated, i.e. the adults or all those people 12 and over, vaccinated, and then create those safe school environments. You may have to continue to do distancing as much as possible and masking as much as possible in those schools if there is that concern about spread to children.
So I'll have you both here. My kids are going back to school. They won't be vaccinated, possibly, but masking is going to be optional. My kids have no problems wearing masks. They wear masks all the time. But should they be concerned that we now know they're going to be mixed in with kids who aren't masking? So what would be your final message? Mask if you can?
I say mask if you can until we know more. Keep the whole world safe. Keep yourself safe. It does help. I don't know that many people follow that. I've been trying to say that all along. People quit. I was still masking pretty well in grocery stores. I was at the grocery store last night and nobody masked, but I had a mask on, and a few of the employees did. I think it's just fallen off, and I think unless we see another big wave, because we're seeing a small wave now, but if we see another big wave, I think people will probably go back to it and feel safer by masking. But but Hawkeye is just hard. It's hard to make people keep their mask on right now.
Yeah, exactly. And we have never been living with masks. We don't want to do it. During this pandemic, we've had to do it, but I agree with you. It is hard to keep people with their mask on. We shouldn't have to mask, but right now we have to do that, and that is a safe thing to do, especially if you are unvaccinated.
Here's how I would describe what's really happening. So if you remember Yosemite and Old Faithful, right? Old Faithful goes off at a certain time every day. People come from all around to watch it, but there are other geysers and they go off. And what I would say is the next wave of the pandemic is it's going to be a geyser. and it's going to go off in those counties, and it's going to be very faithful, just like Old Faithful. It's going to go off in those counties that aren't vaccinated, and that's exactly what's going on in Springfield. And it's going to happen, and it's going to happen the more these people get back together. You know, there was another article that popped out yesterday about unvaccinated sporting events in England being in Europe, I should say, actually. There's more Europe than England, being, and they were talking about soccer stadiums being full. And it wasn't the outdoor soccer event. They hypothesized that it was the bus ride to the stadium and going to the pub after the stadium and hanging out together indoors that did it, and there's been a lot of spread. I think what we have to think about schools is if you let people go together and they're not vaccinated, that's going to be a problem. It's really going to be a problem if they take it home and the older folks aren't vaccinated. That's where you're going to get the geyser. And that's what I think is probably, it's events like that where you're inside and people are congregated together that still can cause the surge like we see in Springfield and other areas of the country.
All right.
It's a geyser. Think about that.
All right, so if my kids are willing to wear masks, I'm not going to argue with that. I'm going to let them keep doing it.
Wear a mask.
I'm not even going to tell them they don't have to take it off. Just keep going. Okay, last question, and then I'm going to turn to Jill to see if she's got any from the community today. But explain the difference between the Delta and Delta Plus.
Yeah.
Okay, we just popped up yesterday for us, I think.
Yeah, you know, the Delta Plus is just kind of, it's of the same lineage of that Delta, just has a different, or a couple different mutations in particular. Unfortunately, the science, not a lot is known about that, not risk or if it causes more severe disease. It still looks like, and it is really not as prevalent as the Delta right now. We know that people have said Delta is more transmissible. But what does that mean? Is the virus, again, is it more fit? Does it help evade our immune system a little bit better? Do you have replication longer? Do you replicate it more? We still don't fully know that information. Certainly, you know, just walking through a cloud or being in contact with somebody for a few seconds isn't going to give you the Delta variant. That has been circulating as well. There's no evidence to suggest that. I think what we have to remember in all of this right now is that while Delta is circulating, people are gathering. People are not wearing masks. And so those type of confounding behaviors really adds to the spread of Delta as well. But as far as Delta Plus, there really isn't much science or information about that. We'll kind of keep everybody updated. But I do anticipate, as we have seen with all of the other variants, that vaccination is going to protect you and does protect you from these variants, just as it protects you from Alpha variant, from the Beta variant from South Africa, from that original Brazilian variant as well. Vaccination is going to continue to give you protection against that wide spectrum of disease, but especially hospitalization and severe disease.
Coming back to vaccination, nothing to add.
Nothing to add. No, he said it. He does a great job. Hawkeye is exactly right. You know, the answer to this question is it is every time, be vaccinated.
Be vaccinated. Yeah. Jill, do we have time for any extra questions from the community today?
We do have a few.
Okay.
And since it's the last of this version, I think we might rock through some of these.
Okay.
First of all, I do want to say thank you to the community for sharing your thoughts and telling us that you're glad we're going to keep being on here. And I know some of you are asking, are we still going to talk about COVID? And yes, every single day. As long as the pandemic is here, we will always be tracking the pandemic, and no matter what the topic is, we will answer those questions. So no worries about that at all. So our first question today comes from Taylor, and he says that, could you share with me the name of the vaccine you talked about yesterday, and if it's not mRNA and it's not viral vector, what is it?
It's kind of a protein vaccine from Novavax. The company. Novavax is a small startup company. It's actually an older technology, but they are the first to be able to produce it for the COVID-19 pandemic, and it had outstanding efficacy in their article representing a study of phase 3 trial, 15,000 patients, that's published in the New England Journal of Medicine.
Yeah, again, it is just the actual, so when you get the mRNA vaccine injected into your arm, your body starts reproducing the spike protein based on that mRNA, which is the genetic code to create these proteins. What Novavax is it is the protein spike, and it's several of them put together, injected with an adjuvant to help that immune system kind of kickstart, which we call an adjuvant. So you're basically just making that immune response to that spike protein. It is similar to the viral vector vaccine in the way that the viral vector has that spike protein on it. So basically, the Novavax vaccine is really just several of those spike proteins all together in one little group, or floret as it's been called to in several podcasts. But you're creating that immune response just to that spike protein.
Okay, and Taylor's second question is the same as Mike. And Mike's, and he writes, while the vaccines are great prevention, they're not 100%. Why at this point do we not hear more about effective outpatient treatments to help lessen the strain on hospitals during the outbreaks? And Taylor says, what are the treatments?
Yeah, those are great questions. I think that there's a couple of therapies out there, but they are not simple therapies. We don't, you've heard on our studies when Dr. Castro was here talking about some new research opportunities looking at perhaps pills or drugs you can inhale. But that's not been approved yet. It's not even gotten early use authorization yet. It's still being studied. What we do have, Hawk, are pretty reasonable monoclonal antibodies. We can give you antibodies to the to COVID-19 to try and prevent your body from getting as sick, and those are very effective. At first, we were pretty restrictive. We've loosened those a little bit, and monoclonal antibodies are now even better than they were before. But if you've been vaccinated and your body's making antibodies, they probably don't have as much of a role.
No. Correct. The vaccination, the prevention of getting COVID-19, getting that disease, is leaps and bounds above any treatment that you can get. Once you get infected and you start having symptoms, you're unvaccinated, you are at risk of all those other things. Long haul syndrome, the blood clots. These vaccinations protect against that. So as you talked about monoclonal antibodies, the other issue with monoclonal antibodies, however, is that as the virus changes, some of those monoclonal antibodies may not work as well. We've already seen that that initial one monoclonal antibody from Eli Lilly has been taken off and is not used anymore because of the variants. They no longer have activity. So nothing right now beats the vaccination. The outpatient therapies really is only the monoclonal antibodies. We don't have any oral drugs like Tamiflu we use for influenza, but even that is not a very good drug per se compared to what the benefits of vaccination offer.
And the other thing, and just to say, you have to give an infusion, you have to get there in time, you have to get it with a certain amount of time, and there are a lot of side effects to the infusion, right? People can get pretty sick with the infusion. Sometimes you have to be hospitalized after the infusion. So I think it's better than not doing it. Especially if you have chronic health conditions, you should get the infusion if you've not been vaccinated. But the simple answer to the problem is, if you just get vaccinated, you don't have to worry about taking a drug that's a little bit can make you a little sicker. So it's just funny to me. And I'm so disappointed the Eli Lilly drug didn't work because I loved saying bam, lam, and that. That was just cool.
Now, they still do have a product. You have to combine it with another product. But overall...
But it's not as cool to say. The name is not as cool as bam, lam.
All those monoclonal antibodies have cool names. But nothing beats that prevention you get from vaccination when you already have an intact, specific immune response ready to go should you encounter or be infected with the virus.
But to Mike's point, too, if I've been vaccinated but I get sick, can I have any of those treatments?
They really aren't meant for you.
If you need them?
There's a very long, complicated medical answer to this question, but at the end of the day, if you've been vaccinated and you're making antibodies, you'll start to get sick. You're probably not going to, the odds are you won't die, and you may come in the hospital. At the worst, you're probably not going to be in the ICU unless you have a whole lot of underlying medical conditions, which means your body's not making antibodies. And then you can get those drugs as long as you get it relatively early. But most people make plenty of antibodies from the vaccination, far more than we give you, far more than we're giving you. And those are a lot longer lasting than the ones we give you. So that's really the way to go. It's not, it's just not even comparable. But you can even get vaccinated. There are some conditions in which we'll go ahead and give you the monoclonal antibodies because your body's not making antibodies. And we can try to check for that, but it's difficult and there's a long-winded explanation, but just get vaccinated.
Okay, a couple of more questions. Stacy wants to know, can schools of 12 plus require vaccines like other required vaccines?
I'm not sure that's a question for us.
Yeah.
I think that we'd be swimming out of our lane. Some schools have done that, but I'm not comfortable trying to answer that question. I think that's a good public health question.
Yeah.
I think if we got public health experts back on here, and maybe we can talk with Dr. Girard a little bit about that on July the 14th, how KU is going to approach that. They're not so far. William Jewell College, and oh gosh, there's another one in Kansas City that is required that I just read about it. Rockhurst is also going to require vaccination to come back on the campus unless you have a medical excuse. So there are campuses that are doing it in the Kansas City metropolitan area, my alma mater, and also William Jewell, and also Rockhurst. But I don't know of anybody else in the immediate area that is. And I think the question, can you, becomes a question of public health and whether or not you're a state-funded entity and how the state government's reacting and what the rules are in your state.
That being said, as physicians, we are fully involved and fully support vaccination, especially against childhood vaccine preventable diseases. We see, there's been some uprise of measles. We know that other parts of the world where vaccinations campaigns have been reduced because of the pandemic, such as polio, those things are cropping up as well. So we are always in support of vaccinating against those vaccine preventable diseases for all ages.
You can answer Stacy's second question, though. She says, that said, why won't KU require it? It makes me feel uncomfortable thinking I may go into a doctor's appointment and be exposed to unvaccinated healthcare people.
Oh, that is a great question. So, that's fair. Now, first of all, we mask. And so we know that masking prevents transmission. We've proven that in the hospital every day. When we had a lot of COVID-19 and we didn't have vaccination, we didn't give COVID-19 from our patients to our staff because they're masked. So our staff are masked and our patients are masked. That's still a requirement, and that's still a CDC requirement. And it's actually now an OSHA requirement. And so you're going to be safe. Having said that, I think that when there is the FDA authorizes these vaccines, and I think Pfizer and Moderna are going to get authorized in the very near future and sometime within, hopefully, the next few months, I think we will be entertaining the question of mandatory vaccination for staff. And just to say, I think every hospital in the area is going to do that, just as every hospital is nationally. If you look at the data, multiple communities, St. Louis, D.C., Philadelphia, Boston, all sorts of communities, the hospitals are coming together and saying, we're going to require vaccination either before on or around September 15th, that's a date that's out there for a lot of folks, or once the FDA has been authorized. And we're starting those conversations in Kansas City as well. So I think the likelihood is that all healthcare institutions are going to require vaccination, just as we did for the flu. And just to say, out of the 14,000 employees we have, we only had 33 people not take the influenza vaccination. So if we could do that with COVID-19, so can you. And you should too.
Two final questions. Margaret wants to know, numbers really increasing in St. Joseph, and I also heard that Mosaic is now restricting, the hospital there is restricting visitors again because those numbers are going up. She says, I have been vaccinated, but cannot help worrying about going out. My stress level is back up. What can I do?
Well, first, it's a geyser. It's like we said earlier, right? If you live in an area where there's a lot of unvaccinated folks, then the data shows that's where the geyser is going to be. That's where the rise is going to be. That's what happened to Springfield, and yes, it's happened in northwestern and north central Missouri. It's happened to other areas of the country, and so it's more of a geyser than a wave now. And I think we should expect to see more of it, and that's what's true around the world, right? As I said earlier, England's the numbers of hospitalizations aren't really up overall because they got a lot of folks vaccinated. You go to other areas of Europe and they're seeing another wave. And why are they seeing a wave? Not as vaccinated. And so for an individual who's been vaccinated, if you're at all concerned, put on your mask, go out in public, keep your distance, cough into your elbow, don't go out if you're sick. All the rules of infection control we've taught from the very beginning, which we've proven here in our hospital and all across the country. The rules keep you safe. You can stay safe in St. Joe, Missouri. Do the same thing you did earlier in the pandemic. Try it, and you're vaccinated. So you really have a lot more safety than you did early in the pandemic. You can still go to the grocery store, you can still go out to a restaurant, you can still do those things. But as that progresses and more people get sick, there's going to be a strain on healthcare, and that's going to be a concern.
Yeah, I think a level of concern is healthy. I'm not saying anxiety is good, but having that level of concern, understanding what the infection dynamics are, where you're at, understanding what your risk is, I think is healthy. And if you have those concerns, then wear the mask and be outside doing things if you want to go out to dinner or go out to eat. Distance as much as you can. I think that's important.
Okay, and Lilith gets the last question, and really today it's my favorite because we want the public to know that we're not going anywhere, and we are going to talk about COVID. And the question she asked is, so if there should be a big spike of COVID again, especially with the Delta, will the show go back to an emphasis on COVID? And I can tell you the answer is yes, and that guy, they're going to be the ones that tell us.
Yeah, well, and we'll be all bar. I'll be right back.
Yeah.
I mean, if this is here, and Jess is going to be hosting, and I'll be answering questions.
Yep.
Which I've got to say, in this morning show where you've done some hosting, and I just got to answer it. That was kind of cool.
Right,
I didn't
see?
mind that at all. I wasn't sure I was going to like that. I like
You
that.
got in the hot seat. You just have one thing to focus on. Answer the questions.
It's kind
I
of
love
cool,
it.
and I can still riff, and I can still be spontaneous and
Right.
drive Jill crazy, which is the best part of the show to me.
That's kind of your part-time job.
It is my part-time
It is your
job.
part-time
Somebody's
job.
good at it. I like
And
it.
now I will take on some of those driving Jill crazy responsibilities.
All right, that's awesome. Well, listen, I'm off next week, but Monday is a holiday. But Jess will be here on Tuesday with her first guest. Jess, remind us who those are.
Okay, so we are going to be talking about the COVID-19. Like I said, the weight, the 19, 20 pounds a lot of people put on during this pandemic. Folks are trying to get it off. So we're going to be joined by Dr. Greg Nawalnik, one of our psychologists. He's a friend of the show, and also Courtney Rhodes to help us kind of better understand our relationship with food. And if you are one of those people who packed on the pounds, you are in good company. We're going to show you why. We're going to hear from some folks out in the community and kind of some of their struggles. So it'll be a great week. We're going to be focusing on that. I know you've got some final thoughts, but I just have a quick final thought for you.
Please.
My thought is, I know you guys have been working double duty, and you've been giving 100% to patients and 100% to the show. So I just want to tell you that while you guys are out giving great care to our patients, that I will be taking really great care of our viewers. I promise that I will be, making sure that they stay informed and engaged. And my promise to the viewers is that if they need any questions answered from one of these two guys, I have them on speed dial. I have them in my phone. I will text them day or night if they have a question,
And we'll be right
how
back.
your fly fishing
Yeah.
was. How
I'll tell you all about that on Wednesday. By the way, Gerard likes fly fishing, and this guy's here all the time anyway, right? He's going to be right here
he's
for
up.
you.
So,
And
yeah.
if
So
things
we
get
will,
hot, I'll be right back to help out.
We're gonna do everything we can to make sure that the viewer feels like it's the same vibe. We're just going to give them a little bit more, and so it'll be fun.
It is going to be fun. Hawkeye, what are your final thoughts today?
I will try to continue to answer COVID-19 questions well and be informative. But, we'll go from there.
I just want to say a special thank you and a shout out to Hawk. He has been a steady, terrific, reasoned voice throughout this pandemic, and I can't tell you how much I've appreciated getting to know you better and getting to work with you. It has just been the best. I can't wait to keep doing more stuff together. It's been fun.
It's been wonderful. You're definitely the
fun.
personality motor of this. and
Well, but you're the steady voice,
It's easy
man.
for me to answer
it takes
questions
teamwork.
when I have backup from you. So, final thoughts. I want to say happy birthday to my mother, who's a great, smart, awesome mother and grandmother. I think we have some pictures up there. Those are look a little bit young, a little bit old, but
Okay, how old is that? Is that senior year?
that's a little bit old. No, probably college. I don't know. But anyways, happy birthday. I hope you enjoy it. My parents are fully vaccinated. I'm so thankful they got through COVID, being healthy, not getting not getting COVID-19. We're able to get the vaccination, so now we feel a lot better. We'll be able to see them a lot more now in the upcoming year compared to this past year. So again, happy birthday. Other final thoughts? I think it's great news about Johnson & Johnson. We get questions about, do we need to do mRNA vaccine dosing after Johnson & Johnson? That's an unanswered question. There's no data to support that right now. We saw the press release from Johnson & Johnson saying they still offer protection against the variants, especially Delta variant, so I think that's good news. So again, whether you get the mRNA vaccines or Johnson & Johnson, just get out there and get your vaccination.
All right.
What do you got for us?
I do, but I got to ask something else. Jill, what are your final thoughts today?
My final thoughts are that my heart is a little heavy because it feels like it's the end of something, But I'm excited at the same time because I am really grateful that we've had the opportunity and this gift that was given to us by a donor so that we could talk to the public. This has just been so tremendous. And my final thought for right now is thank you to both of you for keeping me safe and my family safe.
Yeah, it's been a wild ride, and all of our interpreters out there have done such a
Yeah.
good job. We
And they're
should
going to
say
stay
that.
too. They're not going anywhere.
So here's my final thought as we talk about being grateful. I'm grateful for all of you who have been a part of this program and tuned in and listened every day and helped us spread the information. Many of you have sent amazing gifts, whether it was this version of a shuttlecraft from the Star Trek Discovery. Some of my favorite characters in life, Uhura, Spock, Kirk, McCoy. Someone made me a fly and put it on this beautiful one of the fly tires over at K&K Fly Fishing, my second home in Kansas City, by the way. And that's a big thank you. People who made us these cool dolls. The nurse with whom I've worked for many years, a Jayhawk dunking a basketball it's a coronavirus. And can I just say the great job KU did? I mean, in Lawrence, or across KU Nation. Yeah.
Yep.
We did dunk it, by God. Well done, KU. Rock chalk. And this darn coronavirus that Amanda Gardner gave us earlier in the year, that we've thrown a TV camera more than one time. And of course, I could agree with you, but then we would both be wrong. I think I know who gave that to me. I'm going to go unmentioned on that one. And you know what it really means is this thought that someone gave us. Because I feel like we've got friends on this program. And, friends are like stars. They shine the brightest when the sky is darkest. That should be a model for this program because that's who we've been. And that's what we've needed with all of you who have been listening to us. And of course, you've heard us talk a lot about the Chiefs and the Royals.
Yeah.
And we're looking forward to keeping them safe. And hopefully the Royals will stay safe and get a little better and win again soon. But mostly, I just want to say thank you to all of our public out there. People like Anthony and Logan have made this program go. And Jill, who's the mother of the media update. I don't think I'm morning update mom. That's what it is. Morning update mom. That's
You
what
were
we're
so
talking
clever.
about that. And to Jess, who I've known you, and you're going to do an amazing job on this program. I have no doubt. Actually, she's going to do a better job because she's so darn good at it, and she's really good at it. So this is going to go great. So my final thought is that no matter how we do this, we're here to keep you safe. And whether that means when you're in our hospital because you're sick, or whether that means because we're having a conversation about COVID-19, or what we talk about behind the mics, when we are open mics, when we do that, our whole job, our whole mission is to keep you safe. And we do that by having honest conversations with real people who are not trying to tout a political agenda. We call that just trying to be honest. And that's how we'll do it, just so we have the entire time throughout this pandemic. And at the end of the day, there will still be no place like home. Now, there's one more thing I want you to know about Jessica. Not only has she worked hard behind the scenes to help us communicate about COVID-19, so has her daughter, Sunny. You remember Sunny? Sunny made a video for us a while back. Jess asked the 7-year-old to help younger children understand the pillars of infection prevention and control, and in a series of short videos called Sunny Says. Recently, that work was noticed by the National Academy of Television Arts and Sciences in New York City. Sunny Says is now a finalist for a Share Care Award in the Children's Health category. We couldn't be prouder of Sunny, and we couldn't be prouder of her mom. That's kind of cool. I got to tell you, these two are cut out of the same darn cloth. We are lucky to have both of you on our team, Jess. And as we say goodbye for today, we're going to have a look at Sunny Says. Most of all, I want you to be safe on this 4th. You know how to do it, and you know how to stay safe. We'll see you in about a week. And thanks to all of you for being a part of this program.
Thank you.
Hi friends, I'm Sunny and I'm 7 years old. Do you know you can stop spreading germs by wearing a mask? Sunny says, make sure you wash your hands or use hand sanitizer before you put on your mask. Take the loops and put it around your ears. Keep it over your nose and under your chin. Don't touch your face. Remember to use hand sanitizer and grab by the loops to take it off. Sunny says, place your mask in a clean bag when you're not wearing it. Make it fun. I made this one. Tell your friends it's cool to wear a mask. Sunny says, get ready for school by wearing your mask out with mom or dad. In the car, outside, and around the house. Good school habits start early, so get your rest and start wearing a mask. Sunny says,